Hi, welcome to Doc Talk. Doc Talk, as you remember, is the Knoxville Academy of Medicine podcast where we talk about health issues affecting all East Tennesseans in plain language. I'm so happy to welcome, joining us today is Dr. Matthew Lorenz, who is ophthalmologist, retina and cataract specialist, and it affects all of us. It's very, very prevalent disease. Just take it away and talk about cataract surgery.
Okay, cataract surgery is one of the oldest procedures that we've been doing on all humans.
We all get it.
That's right. Everybody that lives long enough, everybody that lives long enough gets cataracts. And the point at which you need surgery is the point at which it starts to interfere with your life, where you have trouble seeing. And long time ago, they used to do a procedure called couching, where the cataract got so bad it was like a marble, and they would push it back into the back of the eye. We don't do that anymore. We've come a long way, and like I said, it's one of the oldest procedures that's been done, and so that gives us the opportunity to have advanced in many different ways and iterations over the years. And so it's a very far technologically advanced procedure, and I'm excited to talk about one of the things that we're doing that's very different and forward-thinking in cataract surgery, and that's dropless cataract surgery.
Okay, so right now, I know, just speaking personally, which may be a mistake, but as you develop a cataract, your vision becomes less acute, blurry, cloudy.
That's right.
Because it's almost like I'm seeing through a haze. And then traditional approach for fixing it is to take it out. And they call that what kind of surgery? Just cataract surgery?
Cataract surgery, yeah.
Okay.
Phacoemulsification is the big fancy term for the technology that's used. You emulsify or break up the lens.
And that's surgery.
It is surgery.
Right.
A cataract is a cloudy lens inside the eye. First, anatomy. The lens is behind the iris, or the colored part of your eye, and that lens has focusing power that brings in that light and focuses it onto the retina. And as that lens becomes less able to focus and less able to allow light to pass through it, that's what happens when a cataract develops. And at some point, it becomes problematic and we have to fix it. The way to fix it is surgery. You make a tiny little incision in the eye through the clear cornea, no blood vessels, no sutures, and then you open up the capsule that holds that lens, and then you remove that lens in small little pieces, and then replace that lens in the same capsule with what's called an intraocular lens, or basically a clear plastic lens, really small, that helps refocus that light back onto the retina.
Okay, so phacoemulsification. That's too hard to remember. I'll just say cataract surgery. Okay, cataract surgery requires going to the operating room.
Correct.
Okay, that's the standard. Okay, now what is dropless cataract surgery?
Okay, so if you were to talk to someone who's had cataract surgery, one of the things that you would know is you need to put in drops, sometimes before the surgery, a couple of days before the surgery, and then after the surgery, up to a month after the surgery of drops. We have examined the evidence behind using that drop protocol, and what has come out was a large study in Europe that helped reduce the risk of infection called endophthalmitis, which is an infection inside the eye. After cataract surgery, they showed that there was a protocol that could be used to drastically lower the rate of endophthalmitis after cataract surgery.
Okay. I'm going to pause just for a second.
No, it's okay.
Yeah, okay. So I have a cataract. I go to surgery, and then because you're making an incision and you're new things behind my cornea, there's a risk of an infection, just like when you cut your skin.
Absolutely. Anytime you do anything, there's a risk.
Okay. And that infection could be really bad. You lose vision.
Yes.
Okay. So we use drops to make sure you don't have an infection. And okay, I'm with you now.
Yes. So three basic types of drops.
Okay.
An anti-inflammatory, like an aspirin, non-steroidal,
Okay.
anti-inflammatory. Then you use an antibiotic to help control infection, and then a steroid, again, to help promote healing and to decrease inflammation. Those are the three main drops that are used before, during, and after surgery.
Okay.
And dropless basically means, let's define that as, you don't have to use drops before or after surgery. We change what we do in the surgery to make it so you don't have to put drops in.
That would be great because those drops are expensive.
Over 600, yes, we've had patients who've had to pay up to $1,000 for these drops after the surgery.
Yeah, it's sticker shock.
Yes. So back to that study that was done in Europe, the long story short was we used medicine at the time of surgery to put inside the eye to make it so we don't have to use the drops afterwards. An antibiotic and a steroid at the time of surgery has been shown with strong evidence that you don't need to put those drops in afterwards.
That's great because you're trying to do it and you can't reach your eye and that way you know that the patient's getting the necessary antibiotics.
Right.
Okay, so you mentioned 3 again. That would be the non-steroidal anti-inflammatory drug, which is
like an aspirin.
Like an aspirin?
Cataract is one, or flurbiprofen, or any plethora of those, that category of drop.
okay. And then you put in an antibiotic.
Antibiotic, ofloxacin or ciprofloxacin or Besivance or tobramycin, any category of an antibiotic to help control infection.
Yeah, in case they have an allergy, you have lots of other ones.
Correct.
Okay, okay. And then what was the third one?
The third one is just a steroid drop.
The steroid.
That's the one you probably took and tapered off 4 times a day for a week, 3 times a day afterwards. And that decreases the inflammation or the body's response to any insult. A surgery is a type of an insult to the body, and the steroid helps reduce the inflammation after the surgery.
Yeah. Steroids, decreasing inflammation, do we try to do that so we don't have any scarring or?
Yeah, so the body gets really mad when you do things to it. It gets red, the eye gets red, gets angry, and you can have lots of inflammation inside the eye. Swelling in the retina is one of the things that can occur, and it doesn't feel good, it hurts, and you can lose vision from those complications in and of themselves. So we decrease that and allow it to heal up a lot more smoothly, and that's what that taper of a steroid is.
Well, it makes more sense. I mean, if you're worried about an infection and all of that stuff going on inside the eye, then putting the antibiotics, those 3 things, inside the eye probably is more effective than putting on drops, because when we do drops, we're just hoping that it kind of diffuses to the area, right?
That's it. And there is a study that has shown 3 days of using an antibiotic drop has shown to show that there's penetration inside the eye. So you can measure inside the eye that antibiotic has gotten there. However, if you put the antibiotic in, you know it's there. You put it in at the time of surgery. And that's what that study, large study that has been repeated many times, has shown. It reduces our chance of infection, and we know it's in place.
Okay, so is it a liquid?
Yes.
That you inject into behind the cornea?
Right, behind the cornea, inside what's called the anterior chamber, in that area where we go in to remove that cataract.
Okay. Any risk associated with that?
Absolutely. So my personal journey through this, I started out very skeptical and dove into the evidence and said, you've got to prove this to me, because as a retina specialist, I would deal with a lot of these very bad infections. And so we always talk about a increased resistance to some of these antibiotics. If you overuse them, that takes away our chance of being able to fight infection. So I was skeptical. And after spending several years through the evidence, I've come to the other side. Yes, we need to be doing this, and it works very well, knowing that there are potential side effects that can occur from these medicines. There are several options, but they're minimal and very well tolerated.
So it's cost effective.
Extremely.
It's safe. Probably saves cost too long term.
Oh, extremely cost efficient, because the patient has zero outlay for these drops. Now, the cost is absorbed by the facility and during the time of procedure, but that's a small cost on that end, saves a huge cost to the patient. The insurance companies and payers are really starting to look at this and see that it's evidence-based and very cost-effective to the entire system.
Okay, so right now, because, well, I guess the patient doesn't have to pay any extra for for the development of the newer technology.
Right.
All right, that sounds great. What else haven't we covered about dropless cataract surgery?
You can, I think we've covered pretty much it. If you define dropless cataract surgery as the patient not having to use the drops after surgery, that's it. There is a protocol available that we know of that's supported by evidence to be able to not have to use the drops.
Excellent. Okay, so we're going to have you back.
Perfect.
Because we need to talk about diabetic retinopathy, which affects, diabetes, obesity.
Leading cause of blindness in
Right,
people under
hypertension.
65. Yeah.
So we're going to talk about that in another podcast, right?
Love it. Yes, ma'am.
Excellent. Okay, so thank you for talking about dropless cataract surgery. I'm sure there's more questions. So Matthew, if people need to get a hold of you, how do they get a hold of you?
Well, on our website is www.tneye.care. And our phone number, 1-800-500-4667. And that'll get you to all of our team throughout all of East Tennessee.
So now we know about dropless cataract surgery. Sounds like it would be a lot easier than going out, buying drops, putting drops in my eye. Been there, done that. So that's a wrap.